Sai Ram. We'll resume this session. Up next is a fun and practical session on fireless cooking. It's all about making healthy, tasty food without the need for gas or flame, simple, safe, and perfect for anyone short on time or space. This session shows us that eating well does not have to be complicated. It just takes a little creativity and the right ingredients. Taking us through this session are Ms. Vidhya Ramasubramanian, Ms. Vidhya Balakrishnan, and Ms. Varsha. Ms. Vidhya Ramasubramanian is a culinary educator who focuses on traditional Indian cooking, combining cultural heritage with practical approaches to healthy eating. Vidhya Balakrishnan brings over a decade of experience in teaching wholesome, home-style cooking with an emphasis on simplicity, nourishment, and mindful food choices. Ms. Varsha is a culinary educator known for her focus on health, sustainability, and mindful cooking. She encourages young people to view the kitchen as a space for creativity, awareness, and balanced living. Over to the three women who also run the Department of Nutrition and Dietetics at Sri Madhusudan Sai Institute of Medical Sciences and Research.
Invoking the blessings of the divine. Thanks, Sai Lakshmi, for that wonderful introduction. All of us know that heart is located in the left, but it is always right. And from this morning, we have been listening about the various risk factors for the incidence of cardiovascular diseases. And we also know that it brings about a lot of disruption to metabolic health. While we know this, we also need to be aware that it is largely preventable. And let me tell you that the Nutrition and Dietetics team here at Sri Madhusudan Sai Institute of Medical Sciences and Research, we together have put in all our efforts to make sure that we do our best in patient care and we happen to be integral and integrated caregivers. Right from the time a patient gets admitted till the time a patient gets discharged and beyond, we make sure that there is a blending of appreciable compassion with sustainable nutrition. Today, the next 1 hour, we are going to be dividing it into 3 sections. One is going to be a panel discussion, Behind the Beat. The second one is going to be a session called Thali Without Tawa. And the third session is going to be Eat Right, Beat Right, and Guess It Right, which is a game, and all of us are going to have fun doing that game, I'm sure. So we will basically begin with the panel discussion. To my right is Ms. Vidhya. She is a yoga expert, a naturopath, as well as a senior nutritionist. And to my left is Ms. Varsha, who is a multi-talented nutritionist as well. So from the 3 V's, we move to the 3 P's, which is preparation, preservation, and promotion. Over to Ms. Vidhya.
Thank you, Vidhya, for that beautiful introduction. Thank you, Sai Lakshmi. It's so happy to see all of you still energetic at the last session today. Maybe after the game, you're also enthusiastic. Thank you for that. So the first P is about preparation. This, we call it as a golden period or a plan ahead period. Fortunately or unfortunately, we don't get this pace or a phase because most of the patients come to ER, then they go to ICU, then they are taken to surgical for their procedures. But this phase, if we get the patient in hand, we feel we are very fortunate because we can definitely prepare the patient before they go into surgery, and the recovery rate is 30% high. That's what the research says. When the patients are given to the nutritionist maybe 10 days or 2 weeks before the surgery, that their recovery state is about 30% high. So I'm so glad that this prehab, we call it as a prehab stage. What we do in our institute is, this happens mostly in OPD, when the patient is being detected with a cardiac issue, and they walk into a nutritionist cabin, they get in with the attender. So most of the promises are taken care here because they are very anxious. So whatever promises, whatever we ask to do them, they will do it. Without, to the T, they will follow because they are very anxious. There are patients who have come to us to ask, like, can we skip the surgery if we follow this diet? So they're so anxious at this phase. So we don't right away get into this phase of giving a diet immediately. We first talk to them. We just counsel them. So we understand their background. We talk to them what it means to be about the risk. We give them this education about what diet means to them in this 10 days, why it is important for them to have this diet this 10 days. And we also talk about the risk. What if they don't follow? We also talk about the risk. And then we go with personalized nutrition counseling. So this is what happens in the OPD in a prehab state. So assessment is the foremost thing for any nutritionist. So we start with the ABCD assessment. The first assessment is anthropometry. This is about checking your BMI. We check your waist circumference, and we also check WHR. Then we also see what is their height, everything, height to weight, and we also see their spine alignment, because being a yoga teacher, I see all of this. And what is their, how do they establish their eye contact? All of this we see. Especially in anthropometry, this is BMI with waist circumference. This is very important to us. Then we go with biochemical. Biochemical reading, we do about their iron. Then we talk about their LFT, RFT. Then we see their electrolytes. Then we see their PT-INR. We also see their serum magnesium levels before the surgery. And very importantly, we see their serum albumin and total protein. Because serum albumin by itself is an independent problem or an issue post-surgery for recovery. So we look into it as a biochemical marker. Then we go into clinical checkups, just like their, how do they look? Is there any edema, any puffiness? Are they nutritionally undernourished or malnourished? We see all of this in clinicals. Then we move to dietary recall. We do a 24-hour dietary recall. And maybe if there is 2 weeks given for their surgery, we make them come the next week also and check for a dietary recall. And then their socioeconomic status. Here in rural area, we definitely look into their socioeconomic status, because most of the patients, they cannot afford any supplement as such. In urban, they understand the importance of supplement. Here, they do not understand the importance of supplement, and because it is expensive. So we also look at some socioeconomic status and then prescribe the diet. Okay, these are high-risk patient profiling. Before that, we also look at their addictions. This is very common here, like they are addicted to alcohol, they are addicted for smoking, and tobacco. This is also common with women here, because we, as personally, I have seen few women addicted to alcohol here, because they work very hard in the field and they are addicted to it. First 10 days is very easy for me. It's easy. It's difficult for Varsha in the later state. First 10 days is very easy for me because they are very anxious. They give these promises addiction at this state. And we also go with high-risk patient profiling with obesity. So 2 weeks, can we do anything on obesity? Not much that we can do. But definitely, this is a prehab state where we can actually talk to the patient and give some awareness. They are ready to take the rehab. So this is the phase we make them ready for a rehab. Then comorbid conditions like CKD, type 2 diabetes, hypertension, high cholesterol, all this we look into it. Then financial background, as I was talking to you before, and tailoring practical and affordable plans. This is where, as a naturopathist, I include certain food into their system. Like, we have some interesting things coming up. But what do we do as a naturopathist? I will talk to you about that. So the first 5 key aspects in pre-op counseling is about DASH diet, that is to bring down the hypertension. Then we also talk about color-coded plates, which is visually colors. Like we ask them to include more vegetables. Here, vegetables is not a problem because most of them have their garden just in their backyard. So they don't mind, we advising on more vegetables. They are very happy to eat vegetables. Next is about oral nutritional supplements. This is what I was talking about. It is little, they're not great about it, they are an acceptance. But if there is definitely a requirement, we do insist, and we also educate them why we are giving that supplement. And we label decoding, this is most for urban people because here they don't take anything off shelf. When it comes to pediatric, yes, there is an importance of label decoding, but in urban population, we do that in label decoding because most of them pick up fast foods and things from off the shelf, ready to cook, so we talk about them about label decoding. Then we also involve the caregivers, attenders who are coming here, the family members. We sit with them and we speak to them why it is important for the whole family to follow a certain diet and why it is important to give that psychological positive notion in the table. So we talk about it. So these are some functional food as a naturopathist I include in their diet. One is the white lotus petal powder. We have tried in most of the ashramites to bring down their cholesterol. We have some tested evidence. People can come to me in the hospital and check those evidence. We have 3 months with white lotus petal powder, kashayam. We have brought down their cholesterol from 300 plus to 150 plus. So that is one thing that we always advise as a naturopathist. For type 2 diabetes, jamun fruit is very high in insulin. There are papers depicting jamun fruit is very high in insulin. So we request them to have jamun fruit to bring down their sugars. And of course, for hypertension, white lotus by itself will also help to bring down their, if they're hypertensive, to bring down their BP. Of course, everybody knows jeera water is everybody's house we use jeera water. This is for a good gut health. So I also recommend jeera water every day in their diet after their meal. And last but not the least, for any acidity, because they are very anxious when they come to me. So their acidity levels and their gastric levels are very, very high. So small onions are very rich in, very alkaline, and they are very rich antibiotic. So I request them to take many small onions because the big onions are not Indianish, they are Western. Only after Britishers we started to grow big onions. Normally we use only small onions in our kitchen. This is anti-acidic and they are also very, very good in antibiotics. So these are some tips that I give personally to all the patients who walk in pre-op. And then we carry forward with the surgery and the file goes to the next nutritionist who preserve the patient in ICU. And we take care of them like our own family members. Of course, all of us do that. But when it comes to food, there is an emotion to it. So we also give a little tinge of emotion to it. Thank you so much. I give the mic to Vidhya.
Thank you, Vidhya, for preparing the patient very well before the patient is wheeled typically for the surgery. Cardiac surgery, per se, is a scheduled insult. And the surgical post-operative outcome of the patients who undergo cardiac surgery is largely dependent upon the nutritional status of the patient in the pre-operative state. So, to be very honest with you, the nutritional screening and the nutritional assessment, which is done in the pre-operative state, can clearly indicate about some of the interventions which can actually go a long way in enhancing the recovery as well as reducing the incidence of post-operative complications. Now, if we have to speak in this manner, we need to talk in terms of, one thing which we need to remember the most. That is that every great intervention can be undone by a poor diet. So nutrition is definitely a very powerful, yet it is an underutilized tool. So which is the reason why we have this entire 1 hour dedicated for us to be talking a little in depth about the nutritional intervention aspect. And as far as a cardiac surgery patient is concerned, the first 72 hours post-surgery happens to be a critical period, which gives us an edge to set up short-term and long-term goals for the patient. So the short-term goals for the patient will be to seeing to it that the patient has normal blood glucose levels, and we have to maintain the fluid balance. We also have to be very careful about the electrolyte correction aspect. And what would be the long-term goals? Long-term goals would be enhancing the wound healing, reducing the incidence of post-operative complications, maintenance of euglycemia, and very, very important is maintaining the gut integrity. Okay, and keeping these two in mind, the short-term goals and the long-term goals, the nutrition care plan is very, very carefully drafted. It is documented. And let me also tell you that all three of us are stakeholders in making sure that there is periodic assessment and review of the patients who take up these cardiac surgeries. Now, when we talk about the initiation of food for a patient, we also have to take into account the biochemical parameters as well as the clinical findings. So when we say clinical findings, it is something like a nutritional focused physical examination. That can be like pallor, that can be like edema, or what we call as swelling in the extremities. So some of these aspects need to be carefully looked into. And then we also have to check on how we go about with setting up a feeding plan. So generally there will be an interruption, a very temporary short interruption of sometimes 2 days before we start the oral initiation of feeding for a patient. And this is, something which we all are aware of. So when we start the feeding, it starts with liquids, preferably clear liquids, and then we move on to full liquids and probably to soft diet or a semi-solid diet, and then we move on to the diet, a normal diet, which a patient can tolerate. So usually in an ICU stay, if a patient stays only for 2 or 3 days, specifically a cardiac surgery patient, we need not look at intense nutritional support. But supposing, as Vidhya rightly pointed out and said, that if there is a patient, when we take up the high-risk patient, definitely it requires intense nutritional support. And what are the parameters which we have to take into consideration before we start nutrition? First is the hemodynamic stability. Next, once we start the nutrition care plan, there are various other things which we need to look into. What are those? Well, first is we have to make sure that there is absence of vomiting, absence of diarrhea, absence of abdominal complaints. And apart from this, we also have to make sure that the blood glucose levels are maintained. These are some of the parameters which lets us know that, that we are on the right track, and we could go about, kind of amplifying the nutrition care for the patient. And apart from this, if we have to see, we need to, take a minute to mention that all the food that is given to the patient during the hospitalization comes from our kitchen, which is just, right behind where we are sitting. So we have a dedicated patient kitchen, which takes care of the hygienic patient meals being served almost 5 times in a day. Definitely the safe food practices which need to be borne in mind are very much under control, as we are a part of the HICC team. And the other important aspect when it comes to patient feeding, especially the cardiac patient, is the continuation of the oral nutrition supplements. This is something which can actually go a long way towards enhancing recovery as well as preventing the post-operative complications, which could be of any magnitude. Okay, so this is a day-to-day affair for us to review the patient and then take up the nutrition protocols. Apart from this, in an ICU setup, we also have music which is played regularly, in our ICUs as well as CCUs. So by and large, music therapy goes a long way towards healing the patient, not only in the short term, but also in the long term. Music has a long, a history when we have to talk about enhancing the mood, or when we have to talk about reducing anxiety, reducing tendencies of fear. And there are a host of ragas which are meant specifically to support the recovery aspect of it. So when we talk about the nutrition aspect, I would like to tell you that it is a very holistic approach. So it is a multimodal or a multidisciplinary approach where we have, as stakeholders, we have an entire interdepartmental nice, it's a nice, I should say, liaising which happens. And that is how we are able to make our humble attempts towards making a patient feel important, and we do our best to see to it that the patient recovers at the earliest possible extent with this dollop of love, care, compassion, and evidence-based clinical practice. Over to Varsha.
Thank you, Sister Vidhya, for sending the patient to me next. So this is the stage where the patient is just going to get discharged. And I would like to narrate a story of a patient, So this was a patient named Mr. Ravi. He was 58 years old. And then he underwent a bypass surgery in our hospital. And then they were just about to get discharged, and then the doctor had advised that, dietitian has to meet the patient. So I was just about to go to his room in the private ward. The husband and wife, the patient is Mr. Ravi, and his wife is as attender. They both were discussing that, now this dietitian will come and she'll stop me from eating all the spicy foods and oily stuff, and definitely maybe not even boiled vegetables. From tomorrow you don't even cook vegetables, you give me all salads. This is what the patient was whispering to his wife. And then the dietitian went to the room, and then she patiently listened to what exactly the patient is taking at home. What is the plate look like? What all items do they cover in the plate? She took a 24-hour dietary recall. And then she not only gave a list of do's and don'ts to the patient, but she also had to patiently listen as to what their family customs are, what tradition they follow, and then what are the food choices that patient has. And then slightly making a few changes in his diet, like, all his deep fried items changed to shallow fried or roasted, okay? And all his, in future, whatever his diet would be like, the oily gravies turned into nice spice added, the herbs added, nice fiber-rich diet and protein-rich diet. And his favorite part of the day, that is evening tea, would be generally clubbed with some bhajis and bondas and all of that, which now turned into some roasted makhanas, some roasted peanuts, like this. So basically, the dietitian became a plate changer for the patient. And then the care just did not end there, Next day, after the patient was discharged, he went home. His day began with doing breathing, some pranayama and some breathing exercises. And the yoga therapist who was also visiting the patient had also advised him to do some certain exercises, which helped him, relieve from that anxiety. His lung capacity also increased. And then he started feeling better, And then his healing sessions were also clubbed along with the music therapy, as it was already introduced in the hospital. There are specific ragas, especially Kannada raga, Shankarabharana, and there are many more ragas which can help the patient in healing much faster. So the patient became so accustomed to listening to this music that he continued to listen to these ragas at home, and then it helped him heal faster, definitely. Then, basically, it became a holistic approach, a 360-degree model, where the yoga was introduced, the cardiologist took care of the heart functioning of the patient, the nutritionist took care of the nourishing of the patient, the physiotherapist helped him regain the physical strength, and not feel weak. And then the psychologist who helped him become emotionally stable. And the yoga therapist helped him become fit, So it's a 360-degree model approach. Everybody worked together for the sake of Ravi and with Ravi. So this today we took this 3 P's: preparation, preservation, and promotion, where the patient comes to the OPD, gets admitted and takes advice from the nutritionist as to what kind of diet should be taken, and then at home he follows it so that he is ready for the surgery. And then after coming to the surgery, for the surgeries also, he is being nourished very well and then taken care of. And then post-discharge also, he is not scared that, whole of his diet is going to change, It's not like that. So we just helped him tweak a little bit and then helped him become better. So this is what is 3 Ps. So basically, this circle starts with hospital and ends with his house. So this is where the dietitian does not just become this, what do you say, just a nutritionist, but she transforms him, with his all, he transforms, he became a much better person, maybe spiritually also, with his diet also changing in his regular days, and then he became fit, and he's no more scared that, he has to be taking this kind of diet throughout his life. So he was very happy with the hospital, and then he led his life peacefully also. So this is what we are coming to an end of this panel discussion. Next, we have our nursing students coming over and taking the session. Thali without tawa. Can you guess what it is? It's a fireless cooking session. So they'll be demonstrating 4 items. I will not tell you the names of it because there are moderators who will be taking over for this session. All these are nursing students who have been learning, they're having this nutrition as a subject. So over to them now.
And this patient, Ravi, is our own patient who has come to Sarla Memorial Hospital, and Dr. Anand Agarwal has operated on him, and he had this journey with us. So it's a complete, changeover in the life. The patient is so healthy. We don't even stop after the prehab. We also check with them once in a way how they are doing. Are they regular in their lifestyle? Are they taking their medications? We do call over them and check with them. By Swami's grace, now we have a call center. So, this is going to be more accelerated from our side. So thank you so much for your patient listening. Thank you.
Good evening, everyone. We, the students of BSc Nursing from Sri Madhusudan Sai Institute of Medical Sciences and Research, are presenting in front of you with 4 healthy dishes. It gives me a great pleasure to welcome you all this unique and exciting fireless cooking session, Thali without tawa, where innovation, nutrition, and creativity comes together on one plate. It opens the door to countless possibilities, from refreshing salads, vibrant laddus, and delightful smoothies. Let's roll up our sleeves, open our minds, and ready to create some magic without a flame but full of flavor. Today, let's shine a spotlight on a tiny treat that's bursting with big benefits. No flame, all fame. These are perfect blend of health, tradition, and taste rolled into one delicious ball. So let's celebrate these traditional treats with a modern twist where every bite is whole, crunchy, and truly good for you. To prepare these nutritious laddu, begin by grinding mixed seeds into coarse powder. Add dates and pulse again until the mixture turns into sticky and clumps together. Mix in grated coconut, cardamom, and peanut powder for added texture and flavor. If desired, add a small amount of ghee and combine everything thoroughly using your hands. Shape the mixture into small laddus. And optionally roll them in dry coconut. These laddus are not just tasty, they are packed with fiber, protein and healthy fats, great for energy, digestion and even supports your hormonal and heart health.
Today, let's celebrate one of the simplest yet more powerful superfood, that is snack attack. It is a natural way of unlocking the hidden energy inside the seed. Just someone trying to eat and clean. This is your go-to fuel. Healthy eating can be quick, easy, and absolute delicious. Any guesses? Yes, sprout salad. Now, let me help you with the procedure to make the powerful superfood. Add mashed and chopped mixed sprout in a bowl. Add salt to taste. Add lemon juice and a pinch of cumin seed. Now, garnish with coriander leaves and vegetable. Let me give you some tips to enhance the flavor. Skip chili and add pomegranate seed and sweet corns. For more protein, add paneer cubes into the salads. This is also a good in protein and fiber, also gives a fullness to our stomach.
It's a light, refreshing alternative to healthy sauces and a smart way to turn healthy eating into a flavorful experience. Made with wholesome curd or Greek yogurt, this dip is more than just tasty. Let's start hot-wise, heat-free, by soaking about 2 tablespoons of chia seeds into water for 10 to 15 minutes until they puff up and turn jelly-like. In a bowl, mix some hung curd or Greek yogurt with grated cucumber, the soaked chia seeds, a pinch of salt and a dash of cumin and pepper powder. Squeeze in a bit of lemon juice and toss in some fresh herbs like coriander and mint. Stir everything well until it's smooth and creamy. Serve it with crunchy veggie sticks. Just cut carrots, cucumbers, bell peppers or radish into thin strips. It is a refreshing and healthy snack that's full of fiber, protein and probiotics. This yogurt dip is not just cool, it's super healthy too. The hunker gives you a good dose of probiotics for gut health and plenty of proteins to keep you full.
Now, for the final, most awaiting dish. Cooler from the countryside. It is a winter melon, powerhouse of nutrients, packed in a humble, watery vegetable. It is known for its heating, detoxifying properties. It is a natural diuretic, flushing out toxins, reduce acidity, and support gut health. Any guesses? Yes, ashgard juice. Now, let me dive into the procedure. Blend the pumpkin into a smooth puree. Add buttermilk, now a pinch of cumin powder. Add salt to taste. Now add chopped curry leaves. Mix well until uniformly blended. At last, garnish with chopped corianders. Serve chilled in small glasses as savory special mocktails. Now, let's see some of the benefits this juice contains. Pumpkin is very rich in beta-carotene and it is a natural sweetener. Buttermilk cools down the body and helps in digestion. Curry leaf is an antioxidant and it gives a South Indian twist. The floor is open to take any questions. Any questions? For those who wanted to taste, it will be available. Yes, sure.
The next session is Eat Right, Beat Right, Guess It Right. So there will be a set of ingredients in the monitor.
So first, let's read out what is this game about. So all of you must be having a plate on your chair. Hope all of you have a pen. Then you are unlucky. Those who have pen can play this game. Okay, so welcome to hands-on, fun-filled nutrition game. This is going to be, like we'll all play together. We'll explore how to build a young heart plate for the young hearts. We have so many young hearts in the hospital, right? So have you any time build your plate? What do you generally do at home? How is your plate look like? Rice, mudde, sambar, chapati. This is what, right? So today we'll build a young heart plate, which is going to be, it's young heart plate means it's not only for the children, okay? To keep our heart young, you know? Yeah, continue.
Okay, let's use the provided ingredients to create your own ideal plate. So we're going to give you a list of ingredients that you can use to make your plate heart healthy. So let's combine some scientific knowledge. From the morning we've been hearing what to eat, what to cook at home, and to keep your heart young. So we'll use all those scientific knowledge and also some creativity. You can just show some creativity in your plate. So there are rules. So games doesn't come like that. So there we follow some rules. So it's, let's form teams. Yeah, so you can form teams. So you can brainstorm your own plate. So you can form teams, maybe two.
Can you all form teams?
Yeah, two
Get
together,
up from your
three
chairs.
together.
Yeah.
So you
Form
can form
teams.
teams. Yeah, that's one. Okay, you're all one team. Okay.
Yeah.
So next.
So how many teams are there? Okay.
So all teams will receive the same list of heart-friendly ingredients. So there is, we are not biased about teams. So you will have the same ingredients to make your plate. Use the empty plate provided to design your young heart plate. You'll have 5 minutes to complete your plate. Each team must present and explain their plate. So choose your leader from your team who is going to present it, why, for what, and how. And so how much that each team must see who creates, so we see who creates the most balanced, creative, and heart smart plate. So we'll discuss this after 5 minutes. And every team member, one of you from your team should come and present it, why this, you justify your plate. Why have you made this plate?
You can also come up with one nice recipe.
Yes.
At the end of the game. Okay? One recipe from one team. Heart healthy recipe.
The time starts now.
These are the ingredients. Wait. So, yeah. Whoever has pen, in that one group, at least one person should have pen. You can borrow from other people.
So we have a countdown now. 10, 9, 8. Ma'am, please. 7, 6, 5, 4, 3, 2, and 1. Pens down. Men first. Sir, you're ready.
Sairam, we have divided the plate into 4 equal parts. The first part, we have prepared ragi mudde. And second part, we have Bengal gram boiled. And fruits, we have taken 4 fruits: banana, guava, papaya, and pomegranates. Combination of fruits, okay. So, Rasya Snigdha Stira Hridya, morning I told.
All at one go, sir.
All at one, okay, this is for 1 meals only, sir. So, this is for 1 meals only. So, we had all 4 fruits at one time.
Fruit salad.
Okay, without any added things.
Okay.
Okay. Then mixed vegetables, carrot, beans, kunsa, beetroot, and aapka, okay, bottle gourd.
Bottle gourd. Oh,
Yeah.
okay. Thank you, sir. Yeah. Okay.
Oh, yes, yes. Then we have for hydration, buttermilk.
Buttermilk. Okay. Thank you. So, a break. Applause. Thank you. From this side, can we have someone? Ma'am? Okay. Students. Yeah. Hey, you're done, right? Come. Come, come, come. Come. Okay. Go ahead. Come in the front. Come here.
Sairam, so it's mixed vegetable fruit salad, which usually I follow at home. So we use fenugreek greens, a few curry leaves, pomegranate, boiled green gram, and so from grains, we can add oats if possible. From fats, we can add flaxseed powder and a bit of buttermilk and mix it, salt according to the taste. If alternate to the buttermilk, we can add lemon juice for the soreness.
Okay. Thank you. Thank you. That's good. Okay.
We have one more group ready.
Oh, yeah. Okay. Okay, there's no recipes here, just an idea of what we want to eat. So we've got the ragi ball. We've got sambar made from green gram and Bengal gram. And then we've got salad, which has got pomegranate, the boiled ground peanuts or ground nuts, and flax seeds with grated carrots. And for a vegetable, we just have a kind of fried mixed vegetable with beans, beetroot, and grated coconut. And for hydration is buttermilk. And for dessert is just mixed fruit, papaya, guava, and banana. That's the meal.
Good evening. We made a 5-course meal actually. In each course, 1 or 2 options are there. You can choose. Like first salad will be with it's a carrot, papaya, pomegranate, and guava. With that salad, then vegetables, sorekai, hirekai, and brinjal, and pulses will be with mente soppu and kadale bele. That will be one dish. And for this vegetable curry and pulses, you have either brown rice or ragi with ghee. And desserts, there will be a sweet will be made with grated coconut. And actually, we didn't have anything to add sweet for that in these ingredients, jaggery or anything. So, and then later for hydration, buttermilk and jeera water, and in the end, plain water.
Thank you, sir. We'll take the last participant.
Sairam, we have prepared ragi bal, brown rice with mixed vegetable curry and fruit salad at the end with buttermilk and banana.
Okay, one last. That's all.
Okay, we have prepared healthy brown rice as our rice dish. So it's got brown rice, Mosambi juice, boiled raw carrot, blanch beans, pomegranate, diced tomato, coriander, salt, and pepper. That's our rice dish. We've got Bengal gram gravy with sprouts, cooked in ghee, curry leaves, and herbs. And we have beetroot raita with raisins, sprinkled with grated coconut. And for dessert, we have steamed banana with jaggery. And for our drink is jeera water. Thank you.
So before we close this session, just want to, I know, it's just probably, you can take it as a joke. When we had the same session somewhere outside, and many ladies came up with these recipes, and one of the men folk, his wife was a participant, he came up and said, probably only today I know that she could cook so much, you know. So these are ideas that we get, you know, when we come to a teamwork, that we are capable of something. Yeah, so this is what it means. And we have somebody coming up? Yeah, no. Okay, one more. Okay, last, yeah.
Good evening, everyone. Like our team has prepared a 6-course meal plan. So first, before the food, 150 ml of buttermilk with 1 cup of papaya. And 20 minutes after that, 2 ragi dosa with the sprouts mixture, which contains carrot, beans, green gram sprouts, coconut grated with pomegranate, and then a boiled egg, and lastly, jeera water. Thank you.
Thank you so much for your participation. So what should be an ideal plate according to ICMR? So this is how it looks to have your heart young. So half of it your protein, vegetables, and your grain. Okay, it talks about the portion control. So your vegetables and fruits occupy the half of your plate. Whole grains, your quarter. Lean protein, your quarter plate. Healthy fat in moderation, and stay hydrated. So this is what ICMR says. And we also talk about portion control. This is very, very important because there are cheat days that we would want to take, maybe once in a fortnight. So certain foods are still allowed to keep your sugars little spiked. It's okay to have a good hormone running in your body. So it talks about portion control. So just be conscious and aware of what you're eating, mindful of what you're eating. So this is your ideal young heart plate. Thank you. Thank you so much. Thank you.
here to, from preparation to preservation to promotion of your young heart. So thanks to all of you for your patient listening, and I hope you enjoyed this 1 hour. You have these wonderful treats. Before you leave from here, you can make sure that you can taste these fireless cooking dishes, whichever we have made. It will be either kept in Vidhya Deep or it will be towards the corridor at the end. Sairam.
Our thanks to these wonderful ladies for such a unique session, teaching and reminding us on the importance of a healthy diet and demonstrating such innovative, healthy and tasty recipes. And I think for the next few days, we can all experiment at our homes, on ourselves, on our families, friends, and also in the hostels. I now invite Dr. Ritu Agarwal to please extend our gratitude to them. To Ms. Vidhya Ramasubramanian. To Ms. Vidhya Balakrishnan. And Varsha Ravindra. Have a group photo. Thank you. Coming to the last session for today, we have a heart risk assessment module, a simple web-based tool designed to help you understand your current risk level for cardiac conditions. And I hope you're all carrying your mobile phones. This quick assessment can be done on your smartphone and the results will be available instantly through the app. So here's how you can do it. I request the AV team to kindly project the QR code, please. So you can all scan the QR code displayed on the screen on your phone. The link will take you to a short online questionnaire. Those watching us online can also do this from the comfort of your homes and offices. Please scan the QR code on your smartphone. In the questionnaire, you can fill in basic details such as age, weight, lifestyle habits, and medical history. Submit the form to instantly receive your risk score and personalized suggestions. You can then save or download the results for future reference or a discussion with your doctor. Please note that this is only a preventive step, not a diagnosis, but a very helpful tool to become more aware of your heart health. We encourage all participants to take a few minutes and complete the assessment. I request Dr. Anand Agarwal ji to please guide us further on this.
Sairam once more. Many of the questions are self-explanatory. Regarding that hip and waist ratio, you can just, because if there are some tapes, but for paucity of time, if you can, put it, suppose it's a waist to hip ratio, I suppose. So if your waist is more than that, you can put it more than one. 3 options are there. So have you all got the reports on your mobile? Huh? It should come on to your WhatsApp and email. So you have a risk code, your heart. This is according to a validated risk score of inter-heart risk score. Okay? How many of you have got mild? Anybody got moderate to say, who is mild? It shows, no? It comes up. No, on your WhatsApp you will get a message. Huh? No, on your WhatsApp you will get a message. How many of you have taken, all that crowd on the back, have you taken the score? Sirs, from Muthu sir's contact. You got the score? Sir? You are in the process. $17.4 is moderate. Excuse me, sir. Hello, the person who got 17, can you come forward, please? No, this is an exercise. It only takes 5 minutes for you to put, but it is a very, very powerful tool. No, you can stay there, sir. What is your score? 17. So, what are you diabetic? Do you have high blood pressure? Okay, so you can go back. See, what I would urge is, this is just a sample. You can go home and try again at your leisure. Everybody pay attention here, please. Guys, everybody pay attention. This is no joke. When you say about prevention of heart disease in the young people, we also like to get an idea. Suppose I am there. Right now, what is my risk of getting a heart disease? So all these risk factors of diabetes, hypertension, family history, obesity by your waist and hip circumference, and other parameters like how much are you smoking or not, or are you taking deep fried food, or are you taking vegetables. So it is a very, very powerful tool. Sir, I would like Dr. Sushil Sharma to comment on that. Can you give him a mic, please, on this intra-artery score? Make a comment, please. AV team, can you give him a mic, please?
So this is a very good score. This was based on an excellent study that I quote a lot, and I'll be talking about it tomorrow also. It's called Inter-Heart Study. The beauty of this study is that there were 50 countries that participated in it, all 5 continents, and there are a large number of Indian patients. About 10,500 Indian patients also participated. So it came up with this beautiful algorithm that there are 9 things. If you optimize that, you can prevent 90% of your risk of heart attack. And I'll be showing you the slide tomorrow. So this score actually is calculated from those 9 practices. Something unique that they found out in this study pertaining to Indians were these. Number one is, it's the first ever study that took into account psychosocial stress. All other scores, pooled cohort equations that we use in the science, for example, ASCVD of ACC or prevent of AHA or Reynolds score of Europe, none of them include psychosocial stress. So that was one beauty of it. This study also found out, second thing, for the first time, fruits and vegetables were used. People that eat fruits and vegetables, their risk of heart attack is low. So that was the second beauty of this study, and that's incorporated in the score. And the third is, it's the first study that came out that said that alcohol in any amount in Indians is bad for the heart. And the fourth thing that came out of this was apolipoprotein B should be measured in all Indians. ApoB, ApoA1 ratio of greater than 0.9 is an independent risk. And I'll be talking about this tomorrow also. So it's a very good score because unlike other scores, which take into account some anthropometric and some biochemical criteria and some clinical, this actually takes lifestyle into it also. So it's a very nice score, and that's a beautiful way of putting it and doing it in the public. It's great. Thank you.
See, as Dr. Sharma has emphasized, lifestyle alone. I'm not tired of mentioning. It is, and as I said in the morning, we have to start early, right from my student age. You have to take care of your heart, and it's a wonderful score to risk assess your heart. Now we have got another risk assess profile, Mr. Sujit Kotnoor from Philips. He will give you another idea of, assessing your heart energies. Welcome, Mr. Sujit Kotnoor from Philips.
Pranams to Guruji. Thanks, doctor, and thanks, everyone. I am Sujit. I lead marketing efforts for a venture of Philips. Philips, as you all know, is a very well-known name in cardiac imaging. But the beauty is, while we keep on inventing a lot of equipments, devices to make things easy for doctors to work on patients, Philips also came up with the approach to say, why don't we do something which is going to help an ordinary person or what we call as apparently healthy people to actually test themselves? Because as we see, unfortunately, in everyday newspaper that someone who was doing perfectly well actually had a heart attack, someone died, etc., etc. Very sad news. And seemingly we seem to have, we seem to be going through this for people who say that I tested myself or I was doing fine, I was doing walking, etc. That means there is what people did not realize is there could have been an underlying condition at some point or some variations which would have over a period of time resulted in an attack. We always very passionately say that heart attack doesn't happen in minutes, but it takes years for it to actually happen. That means we keep, as doctors have been talking about it, you keep accumulating every form of either stress, lifestyle habits, or mood elevations, etc., over a period of time, and that results in a heart attack. So tomorrow my colleague will be speaking more about it. At this point of time, we said, let's use technology. We all hear about AI, machine learning. We hear about so many technologies, and we said we'll put everything together. But we did take some very different views. One, we said we are not going to build another device for you to buy. So the best device all of us have is a smartphone. And all of us have it. Very proud to say that India has 750 million of them. Put it in perspective, most Europeans, if they buy it twice, probably it comes to what Indians have it in terms of smartphones. So it's a very, very potent device which you can use to actually measure yourself. Second, we also realized, doctors have been speaking about it, we have learned from them that a condition called subclinical atherosclerosis starts at the age of 9, which means very early we start collecting things which build up as plaques, which means that we need to test irrespective of our age, become aware of where we are going, what we are, and what is there inside before we actually turn up at the doctor and say, can you do something for me? To ask the doctor to do something for us, we need to build that evidence. And that evidence is what we are trying to put it in this form of a QR code. I request all of you to use your mobile phone camera, just point it to the QR code. Again, there is nothing to download. So we have made the technology so good that we said we don't need anything from you. You just need your smartphone. Your own smartphone will open a browser. On that browser, you can go through the process of what it has. And the final thing that it shows is, it says scan. When you say scan, we use a technology which converts your mobile phone camera into a biosensor. Biosensor because you can just keep your finger on the camera as long as it asks you to, which is 90 seconds. And then when you keep it here, it starts recording, and in 90 seconds, we are able to get you heart rate, respiratory rate, SpO2, HRV, heart rate variability, and a wonderful parameter called blood pressure. So all this we compute without you putting a strap on yourself and trying to test it just by using your mobile phone. Then that's what technology is all about, making it accessible to people to use in the most easiest and efficient way. So I welcome you all to please scan the QR code, go through this process irrespective of the age, and the data is you just point the camera onto the QR code, then it shows a link. You can just click on it and then onboard yourself. Yeah, you just need to put it on the camera. When you put it on the camera, not on the flash, just on the camera. Yeah, so the which camera means your screen has to turn red. There is a heart symbol on the screen that has to turn red. That shows that it's a primary camera. He will help you, sir. Any of you need help, we'd be happy to assist you on it. So it's an absolutely simple thing. For now, it's only India. It was made in India, right in Yelahanka. That's where Philips' office is. And for now, it's accessible only to India. Over a period of time, we take it to 130 countries because Philips has offices in all those countries. So what it actually tells you is, it gives you some very important parameters, something called as heart energy potential, which is a marker, or it tells you what has been your immediate past lifestyle. What is the effect of your lifestyle on your heart? The next is important parameter that it tells you is heart strength or heart efficiency, which says how much of effort your heart is putting at this point of time because of our either our non-communicable diseases or our lifestyle or the way we are, how much effort your heart is putting to actually do some work. So that is how we start building your profile. And as you keep going through this journey, whenever it asks you to, again, it is not like a wearable. You don't need to use it every day. You use it only when it asks you to do. So once you do it, it keeps building your profile, and it tells you what does this data mean to you, because most of us in this room might not understand what is heart rate, what is respiratory rate, what is its impact on us, other than the doctors. But this app tells us what does it actually mean to us, what does this data mean to us, and what should we do. So there's a guidance that comes, and it also tells at some point when you should probably reach out to your doctor. And that makes it easy for a doctor because you have gone through a process and then come to a doctor with some evidence. And now the doctor can look at it from the clinical world and say which odd test you need to take and how do we actually treat you much before. So the whole idea is to prevent emergencies and make early referrals. That's the whole pathway to it. Were you able to do it, doctor? Yeah, that's the one. Submit, there is nothing. One second. Gautam. I will help you down. I will come there.